Okay, so clearly the live is not gonna work out. That's fine. I'm gonna do a video. I'm going to put it up when I'm done. Alright, I can share it to YouTube as well. Now, I got a letter. This is about the letter that I posted on my page from a disgruntled nurse who was quite livid that they were offered, all healthcare workers right across the board were being offered $3,000 Jamaican dollars more per day for basically working in the quarantine and isolation facilities, for putting their lives at risk to deal with the coronavirus cases. So basically that means a doctor, nurse, everybody, them offering them an extra, call it 60 grand a month, right? Now, people actually on the post defending this. First and foremost, I got this from a very disgruntled nurse. She was livid. She says some of them are planning a sick out, right? I can't for the life of me understand why they think that 60 grand, which amounts to about 400 US, is enough for our Jamaican healthcare practitioners or Jamaican healthcare professionals to risk them life for. Now you see me love split justice, and people don't like when me split justice. When the nurse is wrong, I cuss them. When the doctor is wrong, I cuss them. But at this psychological moment in time, nurses, doctors, and even the janitors, everybody that works in healthcare right now, they're like gold. Furthermore, we're in a situation where there is a shortage because recruiters are here every month recruiting these people. Let us not forget the whole dengue experience where healthcare institutions were simply overwhelmed by the numbers of patients. Coronavirus is far more contagious than dengue ever can be, right? So we're looking at more patients being affected. Oh, you're going to have disgruntled workers who are fretting about themselves. You know, I was wondering why the live get cut off, and it actually was a woman who was calling me from overseas, quite concerned. Her relative isn't even a nurse. Her relative is a janitor, right? And the relative lives in an inner city community, and already she is being ostracized and scorned because it is well known that she works at one of these healthcare facilities, and she has to clean down even the ambulance that they're transporting these suspected or confirmed cases in. And people are pointing at her, they're scorning her children, right? So it's easy for us to stand up on the outside and talk and say, oh, them know what them sign up for. Them know what them get into when them swear they took an oath. No. Look over China, where nurses and doctors are dropping dead from exhaustion, right? I'm sure they're better compensated than the professionals in Jamaica. From day one, these people were not properly compensated. This is why every single month recruiters come here and take our best and brightest talents, because we don't treat our workers good. Somebody came on the post and said, boy, that is enough because police no make more than that and whatever. Listen, don't compare doctors to nurses, to police, to whatever other profession, to immigration workers. And that's the second issue I'm going to talk about. Don't compare them, right? People go to school, they set out their career path, and they know what they're getting themselves into. When you have an extraordinary circumstance like this, where lives are at risk, right? You know how many healthcare workers in China get this thing and die? The whistleblower himself, Dr. Lee, I can't remember his full name, but I know him name Dr. Lee. He himself, the whistleblower, got coronavirus and died, right? We are asking a lot from these people. They have families, they have loved ones, right? Why is it that you expect a doctor who earns in his private clinic an average of $4,000 per patient to work for an extra $3,000 a day? You talk truth. Talk truth. You're telling a doctor say he must earn $60,000, be satisfied to risk his life for $60,000 a month. You follow me and do the math now. You're asking a doctor to risk his life for an additional 60,000 Jamaican dollars per month, approximately 400 US dollars or less, right? No. This said doctor can make this same $60,000 in a day if he's in his private clinic. If him go do it now, say alright, may I go do it, and him go get sick, him can't go to him private clinic go work now, so he would have given up his private salary as well. I want you to work with me and do the math now, right? Because what you are asking him to do is put himself at risk for 60,000 Jamaican dollars per month. And don't tell me about, oh, it's a sacrifice and it's for the love. How many Jamaican people would want to do that? How would you sacrifice yourself before you ask these healthcare workers to sacrifice themselves? Because you're asking them a tall order. This is a very tall order you're asking of them, you know, right? A very tall order. And me, as I said to you, me curse them all the time. I'd be the first person to curse them when I think that they are wrong. But we have to understand that. Alright, so my video was cut, but me splice it together, so no worry. But interestingly, that was a conversation with a healthcare worker who called me. Another disgruntled healthcare worker. Listen, you people have no idea. This young lady says she is scared. She is scared, right? She's not even a nurse. She's a janitor, and these people are terrified. I spoke to 4 doctors yesterday. In the last 24 hours, I've spoken to 4 doctors, and they are scared. Nurses have been inboxing me, and they are scared. Janitor, she just called me. She's a janitor up there, and she has to be cleaning up after these confirmed cases. She is scared. And furthermore, she is being ostracized by her community members. And pay the people them properly, man. Pay the people them. Pay them. That is the first issue I need to speak about. Right? We can't have people who are expected to put their lives on the line and then they are not adequately compensated. Right? And I don't want to hear that there is no money, because there is money. Right? If you don't pay them and they leave, we are going to suffer for it. We are the ones who will be suffering for it. Pay the people them, give them an incentive to stay. That is issue number 1. Issue number 2. Right? I get a lot of calls, and you know, people know I'm back broad. That's why them call me, and they know that I will basically put the issue out there. The immigration officers are restive. I got a call from an immigration officer today, right? I don't know how these people get my number, but they find a way to contact me. All right, now his grouse is that up to today they do not know who patient 0 is, right? They don't know who landed her. They don't know which immigration officer it was that actually landed her, dealt with her, had a conversation. They don't know. They have not, this information has not been made available to them from their CEO, Mr. Andrew Winter. That's what he told me, is him telling me, said the CEO named Andrew Winter, right? They are very disgruntled because they want the person who managed her or landed her to be in self-quarantine. They don't know who the person is. They've not been given a name, and they are very upset by it because they say the customs officer, the person who cleared her, you remember now you have two sections. When you come through airport, the immigration officer see you first, check your documents, stamp you up and pass you through. You get your baggage, you go to the customs officer. The customs officers have been notified, and the person who cleared her goods is actually in self-quarantine. So now this immigration officer is still at work, not knowing who the person was, so they don't know. And he's still clearing people coming in, so he doesn't know if him even have the infection. And he could have it. It's that contagious, it's droplet. So him, remember, it is spread when the patient is asymptomatic, meaning they have no symptoms at all. Right? So this is another issue that is happening. Him said to me, say, it's bare confusion. Right? They're not getting any information, and they are quite restive. He's saying that, listen, they need to be able to protect themselves. They have not been given any equipment to actually protect themselves, prevent themselves from getting this virus, right? And furthermore, they've been asking for protective screens in front of them, because people come through the airport and them cough and sneeze and it land on them, right? And some of the his words, not mine, he says that some of these people who are coming in, they lie on the... Anytime you see the video itch, just know say it's somebody call me, and is this customs this immigration officer just called me back, because I had asked him to do a voice note and send it to me, and I would scramble his voice. Him called me and tell me a while ago, so them have technology now to unscramble the voice, and his voice, him said them will know is who. Alright, so I said fair enough, no problem. I will impart what you have told me. There seems to be some beef going on between their CEO and them. Him tell me say, as I said, the name is Andrew Winter. I think, if I remember correctly, that's the name. Don't quote me on the last name, but I remember say the first name is Andrew. He's basically saying that there was a sick out some time ago. I can't remember why he said they went on sick out, but they went on sick out. Some of them, of course, as usual, did not join the sick out, and he had some award ceremony and awarded them. But there seems to be some issue going on between the immigration officer and their CEO. I don't even want to get into that. What I'm talking right now is the fact that it is common sense to offer these people barrier protection, protective devices, right? Them want a screen, give them the screen. All right, if they need whatever they need, because they're handling documents with people, sick people. A lot of these people, as the gentleman say, they tell lies on their immigration. You understand? So we need to do better. All right, so basically my phone is like the hotline. So I'm trying, I'm really trying, right? But all in all, we, each and every one of us, have a responsibility. People like to come on and say, oh, the government is trying their best, and we need to appreciate what they're doing, as though we're basically just supposed to just love up everything what them say. The bottom line is, these people wouldn't contact me with their grosses if they were perfectly happy, right? They are the ones who are in the position, and many of you who are talking, you are not in the position. You are not nurses, you are not healthcare workers. I just have the ability to emphasize. People, I mean, what, you hate me because I can empathize with people in them position no matter what? I grow up putting myself in people's position so I can understand what them going through, and I suggest that some of you exercise. Learn how to exercise this as well. Put yourself in the shoes of other people, what other people are going through. That is how you can begin to understand. It's called emotional intelligence. Right? It's called emotional intelligence. Ask yourself if you would really want to put yourself in the position where you are constantly exposed to people with this virus. These are confirmed cases, right? Me know nothing on the body would have got twep, literally, right? If you were forced to confront this sickness daily, right? Worse, you're upset because you have to stay back. As a nurse, you can't, because some of them will hear that they are being forced to stay on compound. You can't see your picnic them, you can't see your husband, right? You have to be quarantined yourself. You have to self-quarantine when you're taking care of these people. So you need to ask yourself seriously if this is really worth it. You understand? So I say big up to all the nurses, the doctors, the healthcare workers, the janitors, the administrative staff, the support staff at these hospitals, the administrators of these hospitals who are putting their lives on the line to protect us, right? To take care of Jamaicans who are sick. I don't say it often enough, I'm a cuss. I love cussing sometimes, but big up on yourself, because we know that you are putting your lives on the line, and a lot of you can do better. The one when you're in the public sector, you can do better. You can, as a nurse, go away and get a job where pay you at least 400,000 Jamaican dollars a month easily, right? As a doctor, you can be in your private clinic and earn so much more money. So this is a sacrifice. It's a great sacrifice. And to the immigration officers, boy, you people are heroes. because you are the ones who have to basically land these people. The Jamaicans are for anybody. You don't know whether them have it or not, and you're working under austere conditions. Big up on yourself to all of you workers. And remember, once you have an issue, you can tell me. Inbox me if you can, or call me, because I am willing, my back broad, and I'm willing to talk about it. I don't care what anybody wants to say. Where I see injustice, right, we need to exercise it. The government has committed $7 billion to tackling coronavirus, and we need to ensure collectively that they get it right. I've already commended them for canceling champs, canceling carnival. We've just heard that they've closed schools. I think that is a master step, and I must give commendations where commendations are due, and I do commend them for that. But we have to tighten the screws. We have to dot every I, we have to cross every T. We have to make sure that our workers are happy. There's a reason why when people go to war, them psych up themselves. So we have to make our workers feel like we appreciate what they're doing now, because they are in the belly of the beast. We can stay on the outside and make up our noise and troll people on social media, you know, but they are in the belly of the beast. They're all putting their lives at risk. You understand? So just pray for them. Pray for their families. Pray for their children especially, right? Because their families are at risk, right? So that's all I have to say. So take care of yourself. We'll talk another time.